Now, the Prime Minister has made a direct appeal to teachers, urging them to keep schools open during the coronavirus pandemic. Scott Morrison says learning from home is not an option for all students, especially those who are vulnerable. Political reporter Jade McMillan joins us now from Parliament House in Canberra. Jade, g'day. So just what exactly has Scott Morrison had to say?
Well, the Prime Minister insists, as he has done right throughout this crisis, that the medical advice to the government hasn't changed and it is safe for schools to be open. He says that the education of Australian children hangs in the balance as the nation responds to coronavirus, and he's used social media to make a direct appeal to teachers. He says that while it might not be possible for all of them to teach in a classroom as they normally would if they have higher risk factors, he says the majority are needed, and that learning online from home just isn't an option for all students, especially if their parents need to physically attend work, or if they're from disadvantaged or vulnerable households and simply won't get the education that they need at home.
These children need you for our schools to remain open. They need you as our great teachers, more than ever. We cannot allow a situation where parents are forced to choose between putting food on the table through their employment to support their kids and their kids' education. And I know teachers don't want to force those choices onto parents either. Because if we do, of course, thousands of jobs would be lost, livelihoods forsaken.
And so, Jay, the schools issue is one that there's probably been the most discussion around in terms of how this is being handled by the states and territories and the kind of perceived disagreements between what the federal government and the states and territories are saying. What kind of reaction has there been to this morning?
Well, you're right, this has been an incredibly controversial issue throughout this pandemic. This message from the Prime Minister comes ahead of tomorrow's National Cabinet meeting and also coincides with the beginning of Term 2 in Victoria, where parents have been told to keep their children home if they can. Now, we haven't heard from the Victorian Government today as yet, but in New South Wales, the Premier Gladys Berejiklian was asked about this morning. She said that discussions about Term 2 in that state are underway and that she would like to see more face-to-face learning as the term progresses. The federal opposition, though, has accused the Prime Minister of confusing the issue. The Shadow Education Minister, Tanya Plibersek, says that this is already an incredibly stressful time for parents. She says that everyone wants to see kids back at school as soon as it's safe, but she argues that the Prime Minister is saying one thing while you've got different messages coming from some of the state governments. She says parents and teachers just want clear information.
Social distancing is more relaxed in Sweden. Much of Europe has gone into lockdown in the face of the coronavirus's relentless spread. But in the spring sunshine, Stockholm's cafes have customers. The schools are open, and the Prime Minister has urged people not to panic.
We hope that they are doing the right thing. I think that, we Swedes normally we are better at social distancing in the first place. So it just feels that we are continuing living the way that we normally do as well.
It's about saving the restaurants. It's about saving the pubs. It's about saving people's work. Maybe we have found a good balance, but let's see when it's over.
The elderly have been told to avoid social contact. Crowds of more than 50 banned, but otherwise people are largely free to go about their normal lives. This is how life might have been in Britain too.
The streets of Stockholm don't look all that different from how they did before the pandemic started. As countries around the world are trying to flatten the curve through lockdowns, Sweden has gone in the opposite direction, avoiding drastic restrictions on public life. Social distancing is recommended, but with schools and businesses still open, the government is reporting thousands more coronavirus cases and more deaths than neighboring countries.
We trust the system in a way that I think more other countries maybe don't as strongly, so maybe And that also plays a part in why Sweden doesn't feel that it's necessary to put such forceful measures at this point until the case worsens.
Sweden is prioritizing herd immunity, a strategy that was considered by other countries but abandoned because it would overload healthcare systems.
Man ska inte gå till jobbet när man är sjuk, och man ska absolut inte nu av flera olika skäl besöka sina äldre anhöriga.
The medical tests are pretty ordinary. Not so the person receiving them. Maria Patricio has volunteered to become one of the first people in the world to receive an experimental coronavirus vaccine, which, if successful, could put an end to the worst global pandemic in a century.
It's not risk-free, but it's very minor, I think, compared to, I don't know, other things that you put yourself into every day. I would say I'm 95% excited and 5% nervous.
The researchers here at the University of Oxford will have recruited 510 volunteers like Maria by the end of the month, when they'll start vaccinating half of them with these first doses of their COVID-19 vaccine. The other half will get a dummy vaccine.
In this case, we're thinking that if everything fell absolutely into place, we could have a lot of data available that would give confidence in a vaccine and that it worked, and even be able to manufacture into certainly the tens of thousands and more likely the millions of doses in about 6 months' time.
It's an incredible claim. Normally it takes a decade or more to develop a new vaccine. But like a new car based on an existing chassis, the Oxford team have made their coronavirus vaccine using a design that's already been proved safe and effective against other diseases, giving them an edge.
Fingers crossed that would work because, you know, everyone's life is on hold at the moment. It's really, really exciting. I do hope it works. If it doesn't work, at least we'll have data to show what could be improved and then kickstart another one.
There are more than 30 other research institutes working on coronavirus vaccines globally, and ultimately that benefits us all. If this project does hit any snags, there will be other options out there for the billions of us living in lockdown. Tom Clark, ITV News.
You're actually testing this on humans right now.
That's correct.
Right? And any issues so far?
There are no issues, and the recruitment, there are 2 dose groups in this study, a 1 milligram and 2 milligram, and the 1 milligram is being recruited now, and then when that one's done, we'll go to the 2 milligram.
Interesting. So how far are we realistically from a vaccine? We're hearing early next year. Is that the soonest?
I think that question is when we'll get to a licensed vaccine that will be delivered for everyone. I think that what you're going to see after the phase 1s is groups move into the phase 2 part and move towards efficacy trials, and I believe you're going to see that data sooner, of course, than you'll get to a licensed vaccine. But if we use an if we use an example of another vaccine that was developed during an outbreak, the Ebola vaccine that was developed in West Africa, once that got through its small efficacy trial and showed it had some efficacy against infection, it was then deployed rapidly as part of its development towards licensure in important and at-risk populations. And we kind of had an idea then it was somewhat effective, and we now were actually using it as a tool while it was moving towards that licensure. So I think that that's really the situation you're going to see here. I mean, there are other situations people are saying like emergency use. Well, those are important as well, but I think you will see at least the one I just said.
So realistically, what's the soonest in the most optimistic scenario? Give me a time frame that we could see a licensed vaccine.
So I think you're going to see a licensed vaccine still, like everyone says, in about a year or so, but I think you're going to see these products come along and start to give us indications of their efficacy significantly before that. And those will then be tools that we can use to start protecting our healthcare workers, first-line responders, people that work in environments that make them at higher risk as we develop them. So I think there's an important stage there of how we roll them out towards licensure.
How much sooner is that?
Well, that could be towards the end of this year.
You're actually testing this on humans right now.
That's correct.
right? And any issues so far?
There are no issues, and the recruitment, there are 2 dose groups in this study, a 1 milligram and 2 milligram, and the 1 milligram is being recruited now, and then when that one's done, we'll go to the 2 milligram.
Interesting. So how far are we realistically from a vaccine? We're hearing early next year. Is that the soonest?
I think that question is when we'll get to a licensed vaccine that will be delivered for everyone. I think that what you're going to see after the phase 1s is groups move into the phase 2 part and move towards efficacy trials. And I believe you're going to see that data sooner, of course, than you'll get to a licensed vaccine. But if we use an advantage, if we use an example of another vaccine that was developed during an outbreak, the Ebola vaccine that was developed in West Africa, once that got through its small efficacy trial and showed it had some efficacy against infection, it was then deployed rapidly as part of its development towards licensure in important and at-risk populations. And we kind of had an idea then it was somewhat effective, and we're actually using it as a tool while it was moving towards that licensure. So I think that that's really the situation you're going to see here. I mean, there are other situations people are saying like emergency use. Well, those are important as well, but I think you will see at least the one I just said.
So realistically, what's the soonest in the most optimistic scenario? Give me a time frame that we could see a licensed vaccine.
So I think you're going to see a licensed vaccine still, like everyone says, in about a year or so. But I think you're going to see these products come along and start to give us indications of their efficacy significantly before that. And those will then be tools that we can use to start protecting our healthcare workers, first-line responders, people that work in environments that make them at higher risk as we develop them. So I think there's an important stage there of how we roll them out towards licensure.
How much sooner is that?
Well, that could be towards the end of this year.
There is now a big race on globally, not just in China and Hong Kong, to develop a vaccine against COVID-19. There are at least 70 potential treatments in development, 3 of them at the clinical stage, which is when human trials begin. Outside China, the US is the only other country now doing human testing, but some experts warn against rushing the process. They say doing that could result in a vaccine that weakens our body's ability to fight off the virus on its own. America's top medical expert, Anthony Fauci, has said a vaccine could be ready within 12 to 18 months, while health officials elsewhere say it could take even longer. Let's talk to John Nichols. He's a clinical professor of pathology at the University of Hong Kong. His team was one of the first outside of mainland China to reproduce COVID-19 in a lab for research. He joins us on Skype from Hong Kong. John Nichols, great to have you back here on the NewsHour. So the finish line, in theory, should be at least 12 months away. How do they fast forward through that process?
Well, normally with the vaccines, you start off with small animals and then move to the primates and then to the humans. But it seems with this one that they've gone straight to the humans, which is a very bold decision, one must say.
Is it risky?
I think it's certainly very challenging, because that's why you have to have the testing in the small animals to make sure that it's safe and that it works. I think the other issue is that you notice that they're all using young volunteers. And this is actually going to be a big problem with this vaccine, is that because most of the mortality in this disease is in the elderly. And in the elderly, they don't mount a very strong immune response. That's called immune senescence. So the best thing should actually be to see what the antibody response is in the elderly rather than the young.
So from a clinical point of view, it would be better if they managed to get a study group, a group of volunteers, people in their 60s and their 70s and their 80s.
Well, that's because that's the target population which has the highest mortality. Because if you remember, we've got an aging population. In Hong Kong during SARS, only 11% of the population was over 65. Now it's 18%. So the best use of this vaccine should be really how much it's going to prevent the serious disease in the elderly.
And this has got to be step change through a linear process. I mean, it's safety, development, efficacy, and then approval. And that's got to be approval handed down by multiple agencies in multiple countries.
That's right. It's going to be very confusing when you've got so many people working on so many different vaccines. Everyone's going to be competing to say theirs is going to be the best. And so then you need to have some sort of trial of comparing different vaccines. So it's going to be a very big logistical and also challenge for all the regulatory authorities.
OK, and phase 2 is randomised testing with some built-in double-blind analysis that comes back to you as a statistical breakdown of the success or failure. And I mean, some people are saying, Anthony Fauci saying that process itself can take 2 years.
Well, that's right. Vaccines can't be rushed in because, as was mentioned earlier, is that if you rush a vaccine too much and you get side effects, then that's going to have a really deleterious effect. And we also really don't know what percentage of the population needs to have the immunity or vaccination to be effective. Things like measles, you need about 95%. So because we really don't know at this stage what the proper herd immunity, it's challenging to know at what amount of the population will have to have the antibodies, either through natural infection or vaccination, for it to be really effective.
I don't know if you've been hearing our earlier conversation here on the news, Mr. Nichols, but we have been touching on this idea of herd immunity. You know, we've got countries like Spain now easing restrictions. Sweden, you could get on a plane, if you could find a plane to get onto, go to Sweden, and the restaurants and the bars and the cinemas, they are open because the Swedish authorities have said, herd immunity, that's the future. Where do we stand now? Give us your insight on this. Where do we stand on the idea that herd immunity might provide some sort of cover in a contained environment?
Well, that's what people are talking about with this large amount of immunity. You've got these people talking about these immunity passports. But the problem is that right now we don't know that the proper amount of what in the community will be effective. And so I think that's why in Hong Kong and other places, they're trying this gradual, letting people to see how much we can actually live with a little bit of infection, a small amount. It's just basically flattening out that sombrero or flattening out this curve to a very, very long period of time. So I think that's what most countries will be doing. We're just testing the water to see how much they can get back to a normal lifestyle without the ICUs and the hospitals being overwhelmed with new infections.
Everyone is talking clearly about a vaccine, herd immunity as well, that's a given, and also built-in immunity off the back of that herd immunity spreading through whichever country, whichever community we're talking about. Chloroquine, that's the other thing that people are looking into in the United States. We've had, it's been reported, we've got dead people in Brazil because they tried chloroquine. The Swedish authorities, the French authorities are saying, no way. Donald Trump, the US president, is saying, actually, maybe give it a go. And they are investigating chloroquine at a scientific, clinical level in the States as well. Is chloroquine a possible or not?
Well, this is, I think, an issue where it's actually the treatment is being sort of led by politics, not by science. So everybody has been saying, let's get some proper scientific trials. I mean, most people now say that French trial has had quite a few flaws and was not really scientifically valid. But the problem is that this whole chloroquine is actually being led by the politics. And so the science is playing catch up. So in a normal situation, we'd be doing proper trials where you have the controls, you have the subjects. But now it's just, people are so desperate that they're pushing aside science. I'm not a big believer in the use of chloroquine because I think the side effects and also it's not really been proven. So, and I think the way in which some areas are just pushing it and recommending the population takes as a prophylaxis, I think is very dangerous, especially with the cardiotoxicity which has been associated with it.
OK, listen to the professors, listen to the science, listen to the doctors. Professor John Nichols, we've listened to you. Thank you so much for joining us again here on Al Jazeera.
Thank you very much.